Developing tonight, for the second time in a week, more Bay Area beaches are shut down because of a bacteria in the water. A water quality advisory was issued for 5 beaches after water sample testing found fecal pollution. In Pasco County, those include Robert J. Strickland, Brasher Park, and Gulf Harbor's beaches. In Hillsborough, Cypress Point in Tampa, and Simmons Park in Ruskin. The Department of Health says the bacteria can come from stormwater runoff, pets, wildlife, and human sewage. The next water sampling date for Pasco is set for July 22nd and in Hillsborough beaches on July 17th. And you might remember just last week on the 4th of July, there was a similar issue in Sarasota County. 3 beaches, Brohard, Venice, and Lido Casino Beach, all had no swim advisories after high levels of bacteria were found in the water. All 3 were back open within days. Now, with all of this nasty stuff in the water, we want to make sure that you have the information you need to keep you and your family safe. So Phil Buck went to get you answers today, and mainly, Phil, is everything that we're hearing about right now all flesh-eating bacteria?
Well, in a word, no. I think, and it's important to keep in mind, there are tons of different types of bacteria out here all the time. Many of them can cause different types of infections. And to be clear, technically, there's no such thing as flesh-eating bacteria. What you see when you see those horrific photos online that people have been posting are the bacteria getting into a cut or a scratch, and then it gets under the skin. From there, that bacteria starts to divide and multiply while it's under the skin. As it does that, it secretes poisons or toxins that destroy the flesh. So technically, that flesh is being destroyed. It's not being eaten, and it's not the bacteria doing it per se. It's the toxins being produced by that bacteria. As for whether or not we're actually seeing more cases of this than normal,
I just spoke to the Centers for Disease Control, and they said it's really hard to get your arms around the numbers and whether they're increasing, because these are generally reported by the state, and then it gets rolled up into the CDC report. It's probably underreported. It's influenced by things like press coverage, so that the more it's covered, the more people are going to be reporting it. So
that was CBS News correspondent Dr. Jonathan LaPook. I talked to him this afternoon. He tells me that, these cases of necrotizing fasciitis, which is the actual condition where the organs in the skin are being destroyed, they are extremely rare. And he says, as you just said, when cases increase, or at least reporting increases when it's in the media a lot, many people may be confusing this with other skin infections, stuff like cellulitis. So important to keep that stuff in mind. I've got a much more in-depth look at all of this for you. That's coming up at 6 o'clock.
And you might see this pop up on your social media feed today if it hasn't already. A Florida woman wants bacteria warning signs at beaches and parks. She says her father contracted Vibrio while visiting her in Destin. He got a sore on his back. Now, she says her dad had cancer and a compromised immune system. Her Facebook post has been shared more than 17,000 times.